SCORE Northeast Wisconsin and WHBY are pleased to bring you Biz Talk, a chance for you to hear from entrepreneurs and professionals as they share their experiences. From starting to sustaining growth, learn the skills needed for your business to be successful. If you miss anything, you can catch the Biz Talk podcast at score.org/Northeast Wisconsin. And now from the Myron Construction Studio, it's Biz Talk on WHBY.
Good morning, everyone. I hope you're having a great Saturday morning. This is Biz Talk with SCORE, and I'm one of the co-hosts, Terry Pinch. And joining me this week is Rick Sense. Rick, how are you doing this week?
I'm doing very well, Terry.
Excellent. You've been able to get any biking in?
Yes. Despite the heat we had this last week, I was able to sneak a couple of rides in. Sure, not like the heat though.
Yeah, it was. I was out at about 8:30 for a couple of days there, so. It wasn't bad. Had to stop because of the smoke, but that's okay. All right. So our guests this week are from Orthopedic Sports Medicine Specialists. And we have Darin Schumacher, who is Business Development and Marketing Director, and Dr. Joseph McCormick, who's one of the doctors of the at OSMS. So Darin and Joseph, welcome to the show.
Thanks for having us.
Yeah, thanks a lot for having us.
Okay. So to get started, just want to talk a little bit about introduction and background. So Darin, let's start with you. What's your background and how did you get into this field?
Yeah, so my background, I'm not a clinician, so nobody wants medical advice first and foremost from me. But I'm a marketing guy. Went to school for marketing at UW Green Bay and worked at a few different ad agencies in northeastern Wisconsin, eventually worked for a large group dental practice, and found this opportunity here at OSMS and got into orthopedics and in specialty care. But one of the things that I love just about being in the healthcare side, on the marketing side, is being able to tell patient stories and just seeing the impact that our doctors and our team has on people and just the amazing things that they're able to do.
Okay. And Dr. McCormick, first of all, what made you decide to go to medical school?
Well, especially with orthopedics, I think a common story that you hear a lot is that I played a lot of sports and so thought maybe orthopedics would be kind of a fun thing to do, which is definitely true of me. I'm the oldest of 5 boys, and we had a lot of sports in my family growing up. But I was influenced by a mentor who encouraged me to seek out medical school, and that was a really good influence. It was a gentleman from Neenah who also became one of the docs working here at Affinity when I first got a job here. So we stayed in touch even past that. And then after that, like I said, the decision on orthopedics was pretty easy.
Going to medical school is a commitment in both time and money. How did you make that decision that you were going to, and what led you to say, okay, I'm going to invest the time and money in this that it's going to take?
Well, I was playing baseball at the time in my hometown, and this was the first baseman was an emergency medicine doctor, and he encouraged me to kind of come and do a shift with him. And after seeing what he did for a living and things like that, it made me be more committed. I think my degree was going to be in biology or maybe get a PhD or do some kind of research or teach. But I really just got excited more about the clinical stuff, seeing what he did. And that inspired me to kind of go back and make that commitment to medical school.
Okay. So let's turn and talk a little bit about orthopedic and sports medicine specialist itself. So can one of you explain what is OSMS and what does it do?
Mm-hmm. Sure, I can take that. OSMS is a doctor-owned orthopedic, sports medicine, rheumatology, and pain management practice. Like I mentioned, we're owned by our physicians, which we'll talk probably a little bit more a little bit later in the show. But we are in network for most insurance plans. We have 9 locations throughout northeastern Wisconsin. And our goal is really to get people back to the life they love, get people either eliminating or minimizing the amount of pain that they're in. We specialize in musculoskeletal care in a variety of forms, and we're proud to be able to do that on an everyday basis.
Okay. So let's talk specifically about orthopedics. What exactly does orthopedics mean, and what does it involve?
So orthopedics is really a study of musculoskeletal health, bones, muscles, tendons, joints, and to some extent, we can do non-surgical treatment options and surgical treatment options. So we're really open to treating in any different way, shape, or form. And like Darin said, as a physician owner, it's kind of satisfying to be able to be a part of that and continue on a growth path with medical specialists that do rheumatology, sports medicine specialists that do injections, pain specialists, the entire kind of plethora of musculoskeletal care. And that's one of my favorite things about being an owner at OSMS.
Okay. So let's talk about that a little bit. OSMS is a doctor-owned medical provider. First of all, what led to the idea that you should have a service like this as doctor-owned outside of the hospital? How did that come about?
So our history starts with two independent orthopedic practices, orthopedic specialists of Green Bay, I believe, and there was another one that, of course, is escaping my mind. But we started as two separate orthopedic practices, both with great surgeons, and then came together as recent as 2010, I believe, and formed OSMS when those practices combined. But I think what's important, and Dr. McCormick can talk a little bit from the ownership perspective, but from the patient perspective, independent medicine is critical to the future. And why it is so important, not only for businesses, because typically they're going to provide a higher quality or a better experience at a higher quality with better safety ratings, and they're going to do that at lower cost. And we'll get into more specific examples for that, but I think that's important. Also, and Dr. McCormick can expand on this, but our doctors make the clinical decisions for the organizations, where a lot of times it's systems, you see administrators doing that. So you have actual practicing clinicians making those decisions, and regularly our doctors get patient feedback that then they will take and they will modify to make that patient experience better. And this has resulted in a 98% patient satisfaction rating, and I believe that is the highest in northeastern Wisconsin.
Okay. So if I'm a patient, what are the things I should be thinking about when I need surgery and there's a availability of somebody like OSMS to do it? What am I going to see that says this is a path I should take?
So I would first say I would encourage anybody who has an elective surgery coming up, if you're not comfortable with what the doctor tells you, to look for a second opinion. We do plenty of second opinions, but I would look at patient satisfaction rating. I would look at their quality and safety ratings. And if you can't find them or they don't give them to you, that's a big red flag for a patient. And then also look at cost. Don't be afraid to ask what a surgery costs and ask them what it will actually cost you when you go into for something as big as that. And again, if they can't tell you what that cost will be, that's a red flag. And so I think patients in general need to be better healthcare consumers. The more patients are better healthcare consumers, the better chance at lowering healthcare costs overall, which are pretty much out of control at this point.
Okay. So brings up an immediate question to me is, I remember when I first started to see the buildings going up, and I was kind of thinking, well, how can they be lower cost versus the hospital, because there's scale of the hospital? Yet from my own experience and from what I've heard from others, the model used by OSMS, so the ambulatory surgery centers, are lower cost. Why? How does that work?
So they're essentially lower costs for two different reasons. One is because we, like our personal surgery centers in Green Bay and Neenah, we streamlined everything for orthopedics. So we only do outpatient orthopedic procedures there. So everything is customized and streamlined for that. So we can limit the amount of overhead that we have. The other thing is that in general, independent ambulatory surgery centers, and that's a key part, the independent part, they bill. Usually it's about, and I know at our surgery center, it's about 30 to 40% less than the same surgery at a hospital or most hospital-owned surgery centers. One of the things that as a patient you have to be careful about is there's a lot of hospital systems with surgery centers now. There's only one in northeastern Wisconsin that bills closer to us. It's still more expensive than us, but the rest bill hospital outpatient rates. So that's where that expense comes in. And for us, we just feel like if there's a way that we can save the patient money while still, again, giving that great experience and at a high quality, high safety in there as well, we're going to do that. And that's one of the things that we pride ourselves on. So that's how we're able to charge lower costs. It's part of our DNA, and it's what we believe.
Okay. So, looking back over you had the two locations really for the first probably 9-10 years of the business, but over the last just about 9 years, you've gone to 9 locations. First of all, how do you manage that with doctor owners? How do you get the right doctors in to be able to grow? Because that's a large growth, plus the surgery centers grew. So how do you manage that and bring in the doctors to support growth?
Mm-hmm. So Dr. McCormick, I can take this one as well if you'd like, and you can feel free to chime in or add. But so to give you an idea of some of our growth, I joined OSMS about 8.5 years ago. We had just hired our 11th doctor. Now we're at 40. And at the end of August, we'll be at 43. So that's tremendous growth, right? And I will say, and this, doctors in general, right, they go to school to take care of patients. That's their first and foremost priority. It absolutely should be. And so, but what we're looking for is a little bit different type of a doctor who also has some business savviness, understands the big picture, understands that their practice is just as important as everybody else's practice, that when the organization succeeds, they succeed. So when we go through our recruitment process, we look for those things in a candidate, people that understand, that want to be good team players, that want to, do what's best, not only for themselves, but for the whole organization.
So when you go from 11 to 43 in a time and place where many areas are struggling to find doctors, mm-hmm. How do you find the right doctors for this organization? Because first of all, you run differently. And it's physician owned, and you have different higher expectations, probably, expecting a broader range of things. How do you manage that, and how do you interview and find doctors that fit into the organization?
So a lot of times our doctors will know people that they've been through with medical school. We also appeal to doctors who have some type of Wisconsin presence. So either they grew up here or their spouse did. And that's a big thing for us. So they're aware of practices like us to begin with. But I think one of the big things, and Dr. McCormick, please expand on this, because what I hear from our doctors is that they enjoy practice autonomy, right? They have flexibility in how their practice is run. And Dr. McCormick, please feel free to expand on that. But I think that's a big thing. They don't have administrators telling them how to practice, that they're able to, manage that themselves.
Yeah, Terry, Darin's really right that when you're at an employee group model or a situation like that, oftentimes the employee group is going to be sort of dictating how we're going to run wait times for x-rays, surgeries, how we're going to schedule things, how software is going to run, and the patient experience gets affected by that. Whereas at OSMS, and I think the doctors can feel it, and so can the nurses and other staff that work here, can really feel that we're driven at patient. We're trying to put patients first in everything that we do, keep it safe, keep it efficient. And it's really fun to be at a place where you can be a contributor to that and be able to play a nice role in excellent patient care.
Okay. We're at the point where it makes sense to take our first break. You're listening to Biz Talk with Score and WHBY, and we'll be right back after these messages.
Welcome back to Biz Talk with Score on WHBY. I'm Rick Sense along with Terry Pinch this weekend, and we are having an interesting conversation with our friends from OSMS, the Orthopedic and Sports Medicine Specialist Group. And we're going to get back to that in just a moment. I'd just like to take a few moments to talk to you about SCORE. SCORE Northeast Wisconsin serves a 30-county area, primarily in northeastern Wisconsin. We have more than 30 volunteers, each an expert in their field, offering entrepreneurs no-cost and confidential mentoring. Those areas of expertise include IT, social media, marketing, cash flow, accounting, strategic planning, workflow, retail, best practices, and many, many others. In order to register for a no-cost, confidential mentoring session and or to learn more about SCORE Northeast Wisconsin, please visit our website at score.org/WI/Northeast-Wisconsin. You can learn more about how the SCORE chapter can assist you with starting and or growing your business, and you can complete an application for a mentoring session. Simply complete the online form and submit it to SCORE. Within a few days, a SCORE mentor will be contacting you to set up a meeting. Remember, SCORE is no cost and offers experts who can offer assistance in many different areas. To get started, please visit our website at score.org/WI/Northeast-Wisconsin. And to support small business people, SCORE Northeast Wisconsin is always looking for new mentors. If you have experience that you'd like to share with others, we'd love to talk to you. We welcome volunteers with experience in all aspects of business. Small business owners need your help, and your experience can make a real difference to their success. Go to score.org/WI/Northeast-Wisconsin. Click on the volunteer button and fill out the short application, and we'll get back to you to explain more. And finally, this reminder about the Biz Talk with SCORE podcast. The Biz Talk with SCORE podcast brings the same real-world information and insights from experienced entrepreneurs and business leaders, just like Biz Talk with SCORE on WHBY. However, the podcast is available when you are. So listen and subscribe. Available on most podcatchers and most podcast apps. Thanks again for joining us on Biz Talk. And now back to our guest. Dr. McCormick, I'm going to throw this one to you first. I think during the first segment, we talked a little bit about some of the benefits of being structured the way that you are. But can you maybe expand on that just a little bit and kind of talk through with listeners the idea of the positive side of doing what you're doing as far as being owned by the doctor group and what kind of freedoms that may or may not give you? And then also kind of some of the challenges that you face because you are structured that way.
Sure, Rick. One of the things I would say is that when I look at my 24-year career doing this, starting out at an academic practice when I was in my training or starting out at an employed practice, which was my first job, you definitely get a sense for who's calling what or how the practice evolves. And that includes discussions about patient care or how quickly I can get x-rays, MRIs, get surgery scheduled, and so on related to orthopedic patient care. And so for a long time, in those kinds of jobs, you would see a sort of natural delay built in or there are other constraints built in that I didn't have control over. And it would get frustrating sort of over time. At OSMS, being physician-owned, we sort of have a all-in-one stop shop or an all-in-one building where I can achieve clinic visits, have x-rays, MRIs, and then eventually, because of the ambulatory surgery center nature, also be able to schedule surgery at a pretty open and free kind of a situation. So that's really nice for patients and satisfying for providers. So like we talked about in the first segment, a lot of providers will seek us out, seeing the advantages of that independence. Some of the downsides or challenges that comes up, and I think Darin can probably speak to this as well, comes up in some of the regulatory parts, whereby some of the surgery centers that initially Terry talked about, the first ones he's seen here in the Valley, at first there'd be government rules placed on which surgeries can and can't be done at a surgery center and which are forced to be done at a hospital. And so that sort of ties your hands that way. And that can be frustrating in that sense. Although what we've seen is that at this point, being able to keep costs low, it's really been an advantage to be in that independent practice because now those drivers start to funnel business toward an ambulatory surgery center and maybe away from a more expensive, perhaps academic or large medical center.
And what about your perspective on that, Darin?
Yeah, I think Dr. McCormick made a great point on that. As far as advantages, I don't know that I have much to add from Dr. McCormick other than I think the high quality, the patient high patient satisfaction and cost. I'd say the only downside is I think there's a perception out there that independent medicine like OSMS is more of a boutique practice because we're just specialty care, and I think people think that means it's going to cost more or it's going to be more expensive. I've heard that from more than one person when actually the opposite is true. If you think about most industries, the more you pay typically equals the quality that you receive or the perceived value. So you think about the more you spend on a car, right? It costs more. The more you spend on a house, your perceived value of that house is much more. It better be a quality house. You're going to pay a lot of money for it. Healthcare in general is the exact opposite. And so I think that's hard for people to understand that, if you're going to pay less at a place like us, you're actually receiving higher quality, better safety, and better patient satisfaction. It's just not how our brains are programmed.
So in the minute or so we have left, you made a comment in our break there and about how you can work with the employers in a way that also helps reduce medical costs. Could you give us a quick overview of that too?
Absolutely. Yeah. Thanks for the question. And that's exactly it. So I think most people don't realize that in general, companies fund our healthcare system, right? If you're a self-funded company, you're paying dollar for dollar what those actual healthcare costs. And so I think that's, and healthcare costs in general are the number 2 expense for organizations after its people. Musculoskeletal care, which is what we deal with, more like orthopedics, is a top 3 expense for those businesses. And so what we do, because we do cost less, we'll work with employers to partner with us, they'll recommend steerage to us or recommend people visit us because they know they're going to get a great experience. They know those quality and safety ratings are going to be there, and they know we're going to do it at a lower cost. So let's take an extreme example really fast, a joint replacement. At a hospital system, you're going to pay at least $50,000. It's going to cost at least $50,000. For us, it's going to be probably around that 30 mark. So at a minimum, that organization for that one surgery is saving $20,000. And so if you can get your employees to do that, right, $20,000 for one surgery really impacts your bottom line. And you can save that money to reinvest in your team, reinvest in the business, rather than spending it on healthcare. And that's one of the things that I do working with organizations throughout northeastern Wisconsin.
Okay. Thank you very much. We're at the point where we're going to take our second break. You're listening to Biz Talk with Score on WHBY. We'll be right back after these messages. Welcome back to Biz Talk with Score. This week we're talking to Darin Schumacher and Dr. Joseph McCormick from Orthopedic Sports Medicine Specialists. So before we get back to our guests, I have a quick update to give you. Just wanted to remind everybody that if you go to our website at score.org/WI/Wisconsin, you will find our webpage with a lot of different things you can learn from. So specifically, if you go to the Learning tab and click on that Learning tab, there's literally hundreds of videos, some upcoming live events, webinars you can participate in, some just the videos from previous live events that cover just about every aspect of running a small business. Most of them are free. There are some with small charges of $10 or $15 if they're ones where we brought somebody in at a higher level to talk through. Many cases of volunteers doing it, but either way, there's some small charges. It does help Score raise some money in those, in some of them. So go ahead and take a look because there's some really good things out there. Again, it's score.org/Northeast Wisconsin. Try that first because that'll take you right there. They changed their website for the 3rd time in about 4 months, so I'm still trying to follow the path. But anyhow, that'll get you there still because they still forward it. So with that, we're going to turn back to Darin Schumacher and Dr. Joseph McCormick. And Dr. McCormick, one thing of great interest to Rick and I, given our ages, is an aging society and how that impacts healthcare and orthopedics in particular. But there's not much we can do about the fact we're aging, but what types of things can the people at OSMS do to help people age in a better way?
Yeah, I mean, it's a really big topic. It's really important, Terry, so I'm glad you're bringing it up. Some of the trends that we're seeing when it comes to an aging society is this. First and foremost, I meet a lot more patients now in their 50s, 60s, and 70s who have a good understanding of what can be done to help keep you active. And so that's really, really great. There certainly was a time whereby patients thought, well, if I get older, I'm just going to have sore joints. There's nothing I can do about it. But nowadays, there's lots of non-surgical treatment options, sports medicine options, minimally invasive options, or even topics like joint replacement that come up at a younger age for a more active population. So we do see sort of a master class of athletes that are folks that were active at a younger age in their 20s and 30s, but don't necessarily wish to give up that activity level. And we sort of work with them to be able to maintain good fitness and be able to exercise the way they want to, both for enjoyment and to maintain relatively good health. And I think primary care doctors appreciate that, patients appreciate that, and our doctors are very accustomed to seeing patients that at different stages of life are looking to not give up activity, but rather embrace it and keep going. We talk about low impact cardio, things like biking, hiking, swimming as a great alternative to maybe running all of your life, but also maintaining strength, like with core strength or weight training in general, yoga, lots of different activities that can extend the amount of stuff that you can do, but also can keep you active and feeling good and maintain your body over that time frame as well.
Okay. So one of the things we're actively finding out about or experiencing is joint degeneration. Why does that happen, and what can be done to improve the outcome of that?
And some of the joint degeneration I see is necessarily related to autoimmune problems and things that, like, my rheumatology colleagues are good at both diagnosing and handling. Sometimes it's due to activity, usually activity that involves injury, but activity in general. And then sometimes it's just hereditary in general. But you're right. I mean, it comes a time in life where maybe you can stay active, but you might want to change the way by which you maintain your cardio health to sort of maintain a little bit better. Or begin, as an example, things like cross-training, not just one kind of a sport. And so that's great too. But those are kind of things I would be thinking about when you're talking about trying to maintain good joint health well past our 50s, 60s, and 70s.
Okay. And has over the last 10 to 20 years, have you seen significant improvements in the way joint degeneration is treated? And do you see more coming?
I do. I mean, starting with sort of my generation of baby boomers, I began seeing more joint replacements at a younger and younger age, both for folks who wanted to maintain high activity level, but also just didn't want to put up with the pain of the joints breaking down. And so some of the kinds of technology advances that we've used have been different designs in joint prosthesis, especially around the polyethylene or the plastic, which is the wearing surface in the joint, so I can get them to last a little bit longer, depending on what age someone chooses to have a joint replacement. But we also use at OSMS, we use digital templating for all of our x-rays. We have robot capabilities for more accurate placement of prosthesis. And those are things that we use to sort of maximize the kind of function we can get out of a joint replacement.
Okay. And so what about new technologies? How is that changing the way surgery is done?
Sure. So we've talked about this before a little bit in my group, and in general, like I said, embracing technology like around digital templating and robot is excellent for the accuracy of placement. Some of the other things I've seen that's, I suppose it's not going to be called a technology trend, but I think it's an important trend, is that the way that my anesthesia colleagues approach patient care during joint replacement has been brought down to a level of less invasive, to the point where the person could perhaps consider a day surgery or a same day surgery for joint replacement. Keeping the anesthesia level as low as they can to be both effective, but not to make it so difficult to recover, so that the patient can participate in therapy, be awake and sitting with their loved ones, tolerate eating lunch that day, and get up that first day with surgery in the morning, and then later that afternoon start their first physical therapy session. Those are things that it did take a while to get anesthesia to that point, but we really pushed that. And like you say, as an advancement, I see that and say, boy, that's really a wonderful way to be able to get into a situation where you're looking to better your life, but get good recovery relatively fast.
Okay. So one of my kind of visions of knee surgery before I had it was always this doctor holding a chisel and hammer and hammering away at your knee. And I remember my first doctor told me, well, some of that's true, but there's more to it than that. And as you look at where the future is going, are there things that you could see robotics coming in and doing more of, and helping and assisting and making it more effective?
And that's already starting to happen. So when I do the robotic knee replacement, my hand is on the saw blade, but the robot is guiding both the angle and the level of resection as set up by the digital template. So some of that does occur already, and all of that is planned ahead of time, which is also kind of an exciting thing to be a part of, because I feel like I've already done that surgery or planned it in the first place, and now we're here just completing it.
I have to ask if you with the robotic side of things, there's always been this vision and idea that medicine's been way out in the forefront on technology, but now with AI, how is AI impacting what you do with a patient and their patient care?
So we're seeing some of that come up in situations mostly for patient education and to talk about some of that stuff. Now, planning also is helpful in that respect, although you got to be careful about certain biases that can be built in naturally when AI is just set about to how it does it. For instance, in Northeast Wisconsin, a lot of the patients I see are white middle-aged men and women. And so some of the technology, if you apply AI to it, might not necessarily have the exact same outcome as when I practiced in Denver and I had more Hispanic population or other kinds of patients. So that doesn't always blend across perfectly. But AI plays a big role in kind of everything we do, including medicine.
Okay, so let's step back a little bit and just talk about a couple of the other areas we haven't touched on too much about OSMS. And you have mentioned it, but things like pain management and rheumatology. Can you talk a little bit more about that and how that's become more important too, beyond just the orthopedic side?
Sure. So, I mean, when you look at complementary or all-in-one orthopedic or musculoskeletal care, it makes sense that people want to embrace a non-surgical treatment option or less invasive type options. And pain management and non-operative sports medicine does help us to both aggressively look for answers, but at times stay away from surgical interventions. That's a patient satisfier and actually a great way to go in a lot of cases. So we do have opportunities to treat spine problems without surgery, and a lot of non-operative sports medicine things so that I can keep you kind of in the game rather than thinking about a big surgery to make then big recovery. That also includes physical therapy to get that all-in-one experience occurs at our buildings.
So
I was going to say, can I just jump in just really quick? Because I think part of that is care philosophy too. So we operate on less than 30% of our patients. And I just have a really quick story about a guy who recently I got paired up with for golf. So I was golfing with a gentleman. He was probably in his 70s. He had a big knee brace on. And throughout the course of the day, he asked where we worked. I told him OSMS. He said, "Hey, I just saw one of your doctors, and I love what he told me in my appointment." So, of course, I had to ask. And the gentleman said that the doctor told him he was a candidate for knee replacement. But he said, "What do you enjoy doing most?" And the guy said, I play golf every single day. I love playing golf. And our doctor told him, "The moment you stop enjoying it so much, that's when you should come back and see me and we'll get you scheduled." So our doctor could have in that moment said, "You're a candidate. Let's get you scheduled right now." But I think one of the things that I love about our doctors is that they know that they're not just treating an injury or pain. They're treating the individual. And I think Dr. McCormick's a great example of that. And I think just all our doctors really work with that whole sentiment. And I think when you schedule with an orthopedic surgeon, you think, well, I don't know if I need to because I don't need surgery. But they're going to explore those other options first.
So one other thing you mentioned and stands out to me a bit is the importance of physical therapy. And the reason I say that because I've had 3 times where I've had to take physical therapy, and all 3 times the therapist has mentioned how it upsets them that people they start on therapy will stop after 2 or 3 treatments and don't come back. So, and just assume they can get by without it. How important is the therapy to the treatment? And what is it that you think makes people say, I don't need it anymore?
Well, I think that traditional physical therapy, and I'm talking about, let's say, maybe 15 to 20 years ago, therapists were trained in a certain way. Nowadays, I do see more doctorate PTs, and they tend to have a little bit more in their tackle box compared to the average PT. And so that would include some of the modalities iontophoresis, phonophoresis, sometimes cupping or needling, other kinds of things that are a little bit more hands-on, and different things that can be tried to reduce inflammation and make the person feel better, along with strengthening and flexibility and other things that can keep you in the game. So it does seem like PT's taking a different approach that way to try and embrace patients and meet them where they're at and make them feel better. But as you mentioned, Terry, I mean, physical therapy following a knee replacement is a really, really big, important piece. It's as important as having a positive mental attitude and having a good support system around you. It's important to have a great therapist and really work hard at those exercises.
Okay. So let's step back a little bit and talk, just cover one thing that I thought was, when I worked with OSMS, which I thought was really nice, was the patient advocates and having somebody to help you talk through how you were going to manage your insurance. Not something that was there in many cases 20 years ago for a lot of things I've gone through, but was really helpful dealing with this. So talk about that a little bit, Darin, if you could, about the patient advocates and what they do and how they help.
Yeah, so we have a role called a patient advocate, which, just as you mentioned, their role is really to guide that patient through the insurance process, or they decide to be self-pay, understand what those costs are and what they're going to be responsible for versus what insurance is going to pick up. I think that's really important. Earlier, we talked about being a smart healthcare consumer, and I think people need to have that mindset that you're buying healthcare, essentially. And so our patient advocates, those are the people you can talk to and say, I'm looking at having this done. How much is that going to cost me here at OSMS? Or I need an MRI, and I'm waiting weeks at another place, but how much is that going to cost me? And so they'll help that patient navigate that process, because let's face it, insurance can be very complicated. I work in healthcare, and I think insurance can be very complicated. So I think the average patient having someone to be able to go to and get that advice and get that guidance, I think is really important, and just makes things easier for people to understand.
Okay. So another jump here to medical training, and it's even more important in this profession than others, but how do you, as medical staff, stay up to date with the newer technologies? What do you have to do to make sure you understand what's going on and can use it to help your patients in the best way?
Right. So medical training, in terms of like residency training, starts just after medical school. But then that really kind of begins that lifelong learning process. And so if you can imagine, like, I learned everything there is to learn about a shoulder, but the anatomy of the shoulder and so on. But we haven't even invented some of the technology I might apply to that shoulder later in my career. So we really use ongoing current medical education and things like that, conferences, teaching, even opportunities to do cadaver labs and work on techniques and training that orthopedic doctors can do to continue with that. And my colleagues in non-operative sports and rheumatology go to the same meetings for that ongoing continuing education. It's really just kind of a lifelong commitment once you start.
Okay. So as you look at your time at OSMS, for both of you, how do you feel about working there versus what you thought when you came in? Were your perceptions correct coming in, or has it been a lot different than you thought?
Do you want to start, Dr. McCormick?
Sure. So, I mean, like I mentioned before, I started at a job that was an employed job and then transferred over to this job of ownership and becoming a partner within the group. And really, it's been just a fantastic feeling to be able to know that those changes that I can make a difference for a patient and in people's lives. And there's been sort of that an express way of being able to get x-rays, MRIs, get people treated, get them in for an injection, all those different things, or schedule for surgery, and in a way make that as independently less expensive as possible, but also have a say at the table, sort of be in the room where it happens, if you want to borrow a term from Hamilton. But that's really been great. Now, the other thing about, I think, OSMS that's really great and palpable in the group is that culture that's been built. And it's the culture both amongst our owners and doctors and nurses, but just even among the staff, because everyone knows they're working in a place that patient's experience comes first, including outcome and best of that we can do. So everyone really feels that, and you can feel that difference working in a group like this.
Okay.
Yeah, and I'll expand on what Dr. McCormick said, especially about culture. I think that was the biggest surprise to me. I came from an organization that I will say did not have the best culture. And in my interview process, you heard, we put a lot of investment, we put a lot of time into culture. And, it's one thing to talk it, but it's another thing to actually walk the walk. And I really feel like OSMS does. We were just having this conversation today with our marketing intern, and she made a comment about how accepting everybody was of her. And I think we have the philosophy here that it doesn't matter your job title, it doesn't matter what you do. Everybody is important and everybody should be heard. Good ideas can come from anywhere. And I think we really, as best as we can. Are we perfect at it? No, we will never be perfect, but it's something we continue to work at. But this has been one of the best cultures I've ever worked in. And I think people feel seen. I think people feel heard, and I think people feel valued. And I think that's a really important thing for anybody that, that puts their time, the amount of time we all do, working at a business.
Okay. And on that note, we're going to lead into our final break. You're listening to Biz Talk with Score and WHBY. I'll be right back.
Welcome back to Biz Talk with Score on WHBY. I'm Rick Sense along with Terry Pinch this weekend, and we've been having a great conversation with Darin Schumacher and Dr. Joseph McCormick from OSMS, the Orthopedic and Sports Medicine Specialists. Before we continue the conversation, I'd just like to take a moment and thank our sponsors for their generous support of Biz Talk. Haling & Associates helps small businesses and individuals not just prepare tax returns, but plan for the future. Haling & Associates, personal connection, positive results. Wherever you are in life or in the life of your business, Johnson Financial Group works to match the banking and wealth services needed to help you complete your mission. Thank you to the Business News for promoting our program and the bi-weekly business newspaper serving Northeast Wisconsin with the latest business news and topics for the region. We are grateful for the support of Community First Credit Union. At its core, Community First Credit Union is a community of member owners where people work together to improve their financial well-being and help one another. New North, the Regional Marketing and Economic Development Corporation, is an active supporter of SCORE. The New North facilitates economic growth and helps people in this region live their best lives. Since 1919, Baird has guided families through investment, trust, estate, and tax planning advice. So, no matter what the future brings, you can be confident you're ready because your family is Baird's focus. So with that, Darin, maybe I'll direct this to you. How can folks might want to learn more about OSMS?
Yeah, if people want to learn more about us, they can go to our website at osmsgb.com. They can also call us if they want to schedule an appointment at 920-430-8113. Actually, they can also schedule on our website with any of our physicians as well.
So as you look forward to the future of OSMS, what's next? What's on the horizon for the organization?
I'll start, but I think what's next is continued growth. Next month we have a hand surgeon, a foot and ankle surgeon, and an orthopedic spine surgeon starting. So we're going to continue to look at where the best opportunities for growth are, where the community maybe isn't being served as well as it could, where access, people have to wait a long time for access. So we're going to continue to look for that. We're going to continue to be good community stewards and invest in our communities. And that's a really important part of who we are as an organization. We ultimately want to be the top choice for our specialties for musculoskeletal care. So bone, joints, ligaments, muscles, anything that has to do with that, we want to be the first place that people think of and people call.
So what about expansion of additional locations? Is that something you guys would think about, or do you like your footprint?
I mean, we like our footprint, but we are always looking at opportunities. I would expect that in the next 5 years, we'll probably have an additional clinic with a surgery center that's currently not in one of the markets that we serve. We're looking for other options where we can extend our outreach, like we call them satellite clinics, but it's where we lease space, like from a PT provider or a chiropractor, sometimes a system, depending on if it's the right system. So we're always looking to see if we can expand our geographical footprint to make it easier for patients, because they can have that initial exam or that post-op or something like that closer to their home. So if there's a way that makes it better and easier for patient care, we're gonna look into that.
Okay. Well, it's been great to have you on the show this week. I've been a satisfied client of OSMS before. I live near the Nina Center. It's got a great reputation and a great building and really nice staff. So I always appreciate the help I got there, and we appreciate having the two of you on the show.
Yeah, thank you so much for having us, and we greatly appreciate it.
Yep, thanks very much.
Okay, thank you. And for our listeners, you've been listening to Biz Talk with Score and WHBY. If you want to hear this show again or hear previous episodes for the last 3 years, you can go to any of your favorite podcatchers or our website at score.org/Northeast Wisconsin. You'll be able to get there and find the podcast for the last 3 years. As a reminder, we've been on the air for 25 years now. Really like to thank WHBY for that. We're just going through who the previous hosts had been a couple weeks ago with somebody, and there's only been about 7 or 8 of us, but it is great to hear from some of those people and see how they're doing. In fact, one of them just started up a podcast in Milwaukee. So very interesting to see. But to all our listeners, thank you for tuning in for 25 years, and I hope you enjoy the podcast as well. Have a great weekend, everybody.